its alkaloids. They reduce pain and induce sleep. Inebriants, they intoxicate and induce symptoms of excitement like alcohol, anesthetics, sedatives, hypnotics, fuels, and insecticides. Deliriums, these includes datura, belladonna, hyoscine, cannabis indica, and cocaine. They causes delirium. Spinal poisons are those which act on spinal cord, like nux vomica. Peripheral are those which acts on the peripheral nerves, like curare. Cardiac poisons, these are the poisons which act on heart and includes digitalis, oleander, aconite, and tobacco. Asphyxiants, these are the poisons which act on lungs and includes irrespirable gases like coal gas, carbon monoxide, carbon dioxide, fuel gases, and war gases. Miscellaneous. This group mainly includes poisons having different actions. They mainly include drugs like analgesics and antipyretics, antihistamines, tranquilizers, antidepressants, stimulants, hallucinogens. Routes of administration of poisons. There are enteral route via mouth or rectum to be absorbed across the enteral mucous membrane, or enteral route via injections, inhalational through air passages, and external application via external application on the bones, unbroken skin, and introduction into natural orifices. Though not a common route of exposure for poisons, injection is the only route in which the entire amount exposed is absorbed regardless of the chemical administered, because the chemical is introduced directly into the body. Chemicals may be injected IV, directly into a vein, intramuscularly into a muscle, subcutaneously under the skin, and intraperitoneally within the membrane lining the organs of the abdomen. Because the blood is the vehicle for chemical distribution in the body, IV injection is the most rapid method of introducing a chemical into the body. The almost instantaneous distribution, together with the irreversibility, makes IV injection a dangerous method of chemical exposure, with a fair chance of causing drug overdose is if properly administered. Because there is a relatively large flow of blood to the skeletal muscles, chemicals are absorbed into the blood relatively rapidly after intramuscular injection. The slow absorption of a chemical into the blood after subcutaneous injection is probably due to the low blood flow in the subcutaneous tissues. Intraperitoneal injection is used only in biomedical research. Absorption is relatively rapid with intraperitoneal injection because of the rich blood supply to the abdomen. Respiratory route. This route is used by airborne toxicants such as solvents, vapors, gases, fumes. The mechanism of absorption are diffusion, phagocytosis, and pinocytosis. Rate of entry of toxicant. Alveolar surface area to which toxin is exposed. Solubility of gas in blood. Size of molecule. GIT route. This route is important for deactivation of the toxin by a variety of processes such as acidity of the stomach, metabolized food in the stomach. Absorption of toxicants in the GIT. These are passive transport, filtration, special transport like endocytosis, phagocytosis, and pinocytosis. Classification of poisons according to source. Natural mycotoxins, microbial plant toxin, and animal toxins. Synthetic sources are therapeutic drugs, pesticides, solvents, chemicals at workplaces, and cosmetics. Natural. These are mycotoxins that are derived from fungi like ergot alkaloids and aflatoxins. The second one is microbial that was derived from microorganisms like tetanus toxins and diphtheria toxins. Plant toxins like phytotoxins. These are phenols, alkaloids, and glycosides. And animal toxins are snake venoms and bee stings. Now, synthetic sources are therapeutic drugs. Every drug in lethal dose can act as poison. For example, paracetamol, pesticides, DDT, and solvents. Solvents are industrial nitrogens, sulfur-careening organics. Chemicals at workplaces. These are inorganic like lead, copper, organic like aniline dyes and alcohol, cosmetics like ethanol and sodium hydroxide. Action of poisons. These are remote, local and remote combined and general. The local action. It results from its direct action on the part affected or involved. Such poison generally produce gross naked eye changes seen at the postmortem examination, corrosion, irritation, nervous effects. Local action is basically at the site of the application of the poison. The remote action, it results from the absorption of the poison into the system. After the absorption, it may produce specific action and non-specific action. Specific action which depends on the effect of the poison on certain organs which, with which it has special affinity. For example, opium, non-specific action. Certain poisons such as corrosives are capable of producing a remote non-specific action such as shock. The local and remote action. This is a combination of local and remote. लोकल जहाँ पे पर्सन जो है वो अप्लाई हुआ और रिमोट एक्शन दूसरी अदर बॉडी पार्ट्स पे जो उसका एक्शन है वो in such cases while there is destructive action on the local tissues causing gross postmortem appearances there is also a toxic effect after absorption. Such poisons, even if their local effects are counteracted by dilution, still kill by reason of their remote effects after absorption. An example of this type of poison is oxalic acid. General action. It results when the absorbed poison evokes response from a wide variety of tissue beyond the limits of one or two systems, as for example arsenic, mercury, DDT. These involve multiple systems of the body and lead to general action of the poison. Thank you very much. Any question?